We are back on Morningline. Thanks for joining us. Dr. Kristopher Kast from Vanderbilt's with us, along with Brian Sullivan, Prevention Alliance, Tennessee. Thank the gentlemen for both coming on. Really great conversation this morning about opioids, opioid addiction, the record-setting numbers of deaths this last year in Tennessee, which is awful. We have Linda on line too. Linda, good morning. Hi, Linda.
Good morning. Try to keep this quick. Back in early 2020, I had major back surgery, and I was in a facility for 4 weeks. And during that time, they had me on 500 milligrams hydrocodone.
Okay.
So I was pretty doped up, but they didn't know I do have a high tolerance for those type of medications. I was there for 4 weeks. The day I was released, they gave me 3 days of 5 pills. But they never did try to wean me off of those 5 pills a day the entire time. And so when I went down to just using like 3 of those a day to kind of save them and push them out, And if it had not been for several family members at nighttime, I don't know what I would have done, because I was in... what is it? I can't think now. I was having withdrawals.
Mm-hmm. Okay. Yeah. Should there be some responsibility there to have helped her get off that, or to transition to not taking those pills?
Yeah, patients who are in the position of having developed a tolerance because of prescribed and taking as prescribed medication really do need to have a facilitated withdrawal with a medical professional.
Okay.
And that definitely can take some time.
Okay. So, and good point, ma'am. It's something to think about and to ask, I guess, about. Ray, good morning. Hi, Ray.
Yeah, I got a question for you. Don't you think it's the doctors in white coats that are the biggest drug dealers in the state of Tennessee? You can look at where doctors have clinics in Alabama and clinics in Tennessee. The same doctor, he'll get caught giving out opioids in Alabama. He just moves to Tennessee and continues to do it while it's court.
Well, and he's not wrong. I mean, there are unscrupulous doctors and pharmacists, and I know that the TBI, FBI, and others have been cracking down on pill mills. We've done stories on it, and I think more of them are realizing they could end up really getting nailed on this. But I like to think it's not happening as much as it once did, but I'm sure there are doctors out there. Hey, there must be just a ton of money to be made on this. That's the heart of it all, right?
Yeah. Yeah, I think that it is improving from where we were. It will take time and whether we ever get to a place where everybody behaves ethically is, that's kind of human history trying to get there.
Yeah.
But I think that there are a lot of ways to enter into an opioid use disorder, whether it's through physician prescribing or through other means, and we often end in the same place as far as somebody needing treatment and making sure that they know how to get into treatment in an effective way, so that we help protect them from having the severe medical problems like an overdose, but also help to get them functional, working, housed, able to engage in their relationships as they used to.
Yeah.
The CDC, when they updated their guidelines for pain management in the 2018, in the year 2018 for doctors, don't you feel like that helped some with, so there was not so much pressure on doctors to say, it used to be if your patient is in any amount of pain at all and you're not treating them, then you're neglecting your patient.
Yeah. That change has helped. It's also led to a really rapid swing, as some of our callers have talked about, where they're on a heavy dose and then all of a sudden they stop it. So I think, we will hopefully, as providers are learning more and understanding, like, how do you get and thread the needle between addressing pain in a helpful way, protecting your patient from developing an opioid use disorder if they happen to be the person with unlucky genes in biology, and then how do you get somebody who's already got that problem into treatment.
Let's take Tom. Tom, good morning. Hi, Tom.
Hey, good morning, Nick. How are you doing?
Good. What's on your mind, Tommy?
Well, we sitting here listening to this talking about legalizing marijuana stuff. I've got a son I just found out that was diagnosed with cancer. He had 6 tumors in his head.
I'm sorry.
Had one next to his lung. And, you know, he don't like pain medication. And I'm trying to get him to get some medical marijuana. But see, these Tennessee lawmakers, they don't care. They'd rather see these people out there pushing these pills. And don't get me wrong, Nick. I mean, you talked about this before. I take 120 hydrocodone 10s a month.
Wow.
And plus I take a Xanax.
Yep.
And, you know, they work, but I've been doing it for 30 plus years.
All right, we're just up against it, and yeah, he's called in before, Tom, and thank you, and he manages it. That's a lot of pills he takes. But we touched on it real briefly about the idea of medical marijuana. The problem for him is that his son lives here in Tennessee, where medical marijuana remains illegal. He could consider going to another state. Of course, getting up and moving and leaving is a pain in the butt. Shouldn't have to do that, but cancer pain, it's brutal.
It is.
It's brutal. I don't know what he's suffering with. The most powerful painkillers out there are used for cancer treatments, aren't they? Some of the pain that you get from that?
Yeah, it is. And that's where, you know, doctors really do need to use high doses and can get people into a very high tolerance and could have withdrawal between doses if they lose access to their physicians.
Is morphine still the strongest?
Morphine is not. So you can use, fentanyl, which we're talking about through the illegal market. There are fentanyl patches which are used for cancer pain. There are even more potent medications than fentanyl that also exist. So but it all should be supervised by your physician and working closely with both your oncologist, your cancer doctor, and your pain specialist.
For sure. Brian, listen, just before we wrap things up, we only have about 4 minutes left. I guess I want to make sure people understand that there is help out there, and maybe you can give some suggestions to folks out there that have been watching today, whether they know someone or they feel themselves falling down an opioid hole, and they deep down know they need help. What are your recommendations? You
know, there are a lot of people. You're not alone. If you're out there and you are struggling, there are a lot of people who think that there aren't resources, but there absolutely are in Tennessee. There's the Tennessee Red Line that you can contact if you feel like you need addiction treatment. That's 1-800-889-9789. You can contact the Prevention Alliance of Tennessee if you would like education provided in your community group or school. You can contact us at info@tncoalitions.org. And even if you're battling a mental health issue, there's Tennessee Voices, and you can find them at tnvoices.org and 1-800-670-9882 if you just need mental health treatment. So there are a number of resources available. You know, you don't have to live that way. There's a better way to live, and you know, I believe in you, and I love you.
Yeah, and that's what it's about. Thank you for sharing that. And the bottom line, too, is you said, though, as we're coming out of this pandemic, though we're taking a little step back right now, unfortunately, with the Delta variant, but the numbers aren't necessarily going down. Right? So, I mean, what he's preaching there and being aware of this, we have to recognize it. I'd hate to see this trend continue, and we set another record in 2021.
Yeah, I think we're unfortunately on track to set that record right now. I really want to make sure that our viewers know how to access treatment for themselves, but also for a loved one, and to know that there is good treatment out there. We have individuals getting into recovery every day, and it's important for them to know that just beginning to put one foot in front of the other, come and begin to work with a medical team.
And it may come with counseling. We just have like a minute and a half, but I mean, some of the treatments, I have friends whose children went through this, and they, for a period of time, were on Suboxone and some other of these drugs. And you said, think about Suboxone as being what? Because I was like, isn't that just another drug that's going to get you high?
Yeah, so I think about it more akin to insulin for diabetes than an antibiotic for an infection.
Ultimately, though, is it not the goal, hopefully down the road, to eventually come off Suboxone as well, though, whereas an insulin you'd have to take the rest of your life?
Right, so some individuals do eventually want to taper off, but it is a long process, and it's important to have everything else in life, work, housing, relationships, rock solid.
So you can be on that for years.
You can, and it improves outcomes versus not having treatment. So.
Okay, but as with anything, it's something that maybe makes life better for you, but there are side effects to every single one of these drugs that are probably something you just assume not have.
There are definitely side effects. At the same same time, there are pretty severe effects of having a relapse event.
Of course.
And ending
well, no, yeah, of course. Those side effects suck, but it's way better than having a relapse with the opioid, right? Guys, thanks both for coming on. Really good conversation. You guys are terrific. I really appreciate it. I hope we help some people out there today. But thank you both. We'll take a break. I'll be back with a programming note about tomorrow right after this. Stay with us.